Sports are a part of most kids' lives, but there's always that worry that one day your child will get hurt.
You know, when we talk about the potential for a concussion or the potential for a head injury or any kind of an injury, nobody wants their child injured. And you have to be realistic too. We can't wrap our kids in bubble wrap. We want kids to enjoy a physically active life.
Dr. Sally Deitz is a physical therapist and founded Integrative Pediatric Therapy in Dallas almost 25 years ago for kids with minor and severe developmental issues.
One of the treatments that we use in conjunction with our physical and occupational therapy is something called craniosacral therapy. It's a light touch manual therapy. It really helps the central nervous system to work more effectively.
And 10 years ago, she started getting a new kind of patient, those with concussions.
I had this big aha when we started working with these concussion patients, again, primarily with the craniosacral therapy, about the symptoms that they were exhibiting were so similar to our kids who have learning differences. You know, a lot of them have balance and coordination issues, vestibular, visual, and it just felt like there had to be something more that we could do.
Thus, integrative concussion therapy was born.
We have vestibular therapists, vision trained therapists to look at functional vision. We look at balance, coordination. We do the craniosacral therapy. I've been involved with a study with the Ricky Williams Foundation and the Upledger Institute out of Palm Beach, Florida for the last couple of years, where we were just using craniosacral therapy as a treatment for ex-NFL players who suffered from a lot of post-concussive-like symptoms. And not only were they better at the end of the 5 days, when we retested them 3 months later, they were still better than where they were when they entered the program.
But Dr. Sally says concussions can be tricky, and there are a lot of misconceptions. For example, usually only people who play sports get concussions. False.
The highest number of concussions that we see are actually in our elderly. The other huge group that we see are in your young children.
Another one, you have to hit your head to get a concussion. False.
Your brain is part of a whole enclosed system that goes all the way down your spinal cord into your tailbone. And anything that disrupts that system along the way can cause a shock to the brain.
Finally, you'll always see symptoms right away. False again.
Things that you look for right away are you might have headaches, sensitivity to light, to sound. You just don't feel right. You're not processing information right. You have that fuzzy thinking in your brain. More extreme cases, you might be nauseated or vomiting or really feel crummy. Things that can show up later, especially in adolescence, are trouble learning.
Dr. Sally says at the end of the day, the most important thing that you can do for your child is to pay attention and get a baseline assessment using an impact test, balance and reaction test, and eye movement test so that you have a comparison of when your child was pretty much at 100%. And we'll show you that live on RNCN Facebook page March 27th at 9:30 a.m. For Real News, I'm Sarah Strackhouse.